As you know, I was the first Minister for Health to commission a policy review in relation to medicinal cannabis, and I asked the HPRA, the former Irish Medicines Board, to look at the evidence and to report to me, and they did that. And they did that in January of this year. As a result of that, I've accepted their recommendations in full, which is that they believe that medicinal cannabis should be available, subject to a consultant believing it should be available, in a certain number of cases in relation to 3 specific conditions: certain types of epilepsy, MS, and people who are violently ill as a result of certain types of chemotherapy. I've set up a clinical expert group because this programme has to be administered by clinicians, and they're due to report shortly, and I expect we'll be able to move ahead with the Compassionate Access Programme later this year. So it's very important. But I do have to say this, because I know there are difficult cases out there, and I know on a human level our hearts would go out to anybody in such a difficult case. But I am not a doctor. It's not the job of the Minister for Health to be a doctor, and it is the job of all of us, I would respectfully suggest, to seek the views of medical professionals and medical experts. If a clinician in this country, if a consultant in this country believes that any person, child or adult, requires a substance that is not legal medicine, they can seek a licence from my department. As of now, I have no licences pending in my department in relation to that.
Can I just ask you exactly what kind of work that expert group is doing?